Welcome to episode 111 of the Daily Update. On today's show, we have Lisa Westaway.
Good afternoon. So I have a few updates today. It'll be a short episode. I wanted to talk a little bit about visits to elders on inpatient. So we have made some changes to the room. This was a request that was made from families. So we've made it a little bit more, less like a hospital, a little bit more inviting. So we added some plants and some artwork on the walls. And basically we've had really good feedback. So the goal of these visits was to get people a little bit closer together, increase contact so that there would be some contact between your loved ones and our elders and residents. And so generally people are at a close distance, are hand holding, and it's we've had some really positive feedback from these visits, and from what we hear, residents are also very happy. So I just wanted to give that feedback to all of you that the residents are doing well. They're extremely happy with the visits. It's made a difference in their lives, and in fact when they visit with their loved ones, they're remaining in the visit for the full 30 minutes, and that's a very big difference from the first initial visits that we had at a big distance. Those visits were difficult, and residents were not staying longer than 5 to 10 minutes with their loved ones. So this is making a very big difference. So we are implementing visits in phases, and for the next little while we're going to remain in the location for visits that you've been used to over the last little while. We are not moving up to the rooms yet, and that's because we continue to follow what's happening in the communities around us, but in our own community as well. And we've had an increase in requests for testing of people with symptoms at the testing site, which is good. That means that people are coming in for testing. We have not had any more positive cases up till now. However, the fact that there are an increase in people with symptoms tells us that we should still remain cautious, and therefore we're going to maintain the visits on the ground floor and not bring families up to patients' rooms. But considering that we're getting really good feedback about this, we're going to keep it this way. However, we'll be consulting with families once again through a Zoom meeting in the coming weeks. So if you are a family member of, if you're the main family member responsible for one of our residents, you'll be receiving a letter by the end of the week from KMHC explaining to you what the next what we've been doing, what changes we've made based on your recommendations, and the date and instructions for the next family Zoom meeting. The first meeting that we had was really positive. It was a way for us to communicate with families. It was a way for us to really hear what is wanted by people's loved ones, and in consultation with the residents as well, we're able to make decisions and changes as we move along. So thank you for participating in that. So one of the big changes is that we're scheduling the visits more regularly. So we schedule visits 3 days per week. There are 9 visits per day. Something that's important to mention is that it's the main family member who's on our files for the resident who gets the phone call for the visit. So we're asking that the main family member ensure that their whole family is aware of these visits and that the appointment times are shared amongst your family members, because we can't reach out and call all the family members of each of our residents. We have one main contact. This is important because KMHC has been receiving a lot of phone calls and requests from other family members or friends of residents, and so we ask that you coordinate that with the main caregiver or the main contact for KMHC. We had a drop-off on Sunday. Although there were less people dropping things off for their loved ones, it still was pretty steady, and it's still going well, and we're going to continue that every 2 weeks. So the next drop-off will be August 2nd between 10 and 1, and we'll give you an update about that as we get closer to that date. Lastly, what we wanted to share with you was a new table that we have on our website, but we think is important, especially in light of all the recent events that happened with contacts in bars, restaurants, and different businesses around the community. So this is kind of an algorithm that can help you make a decision about whether you should self-isolate, whether you should be tested, what you should do in the case of a possible contact. The way that the table is organized, I won't read the whole thing, but just so you know, there are many columns. So either I have been in contact with someone, tested, I've been to a place where someone has had COVID-19. I've been to the United States. I think I may have been in contact. And then whether you have symptoms or not, and then what you need to do, either self-isolate and get tested, monitor for symptoms, so there are different possibilities. And then when am I fine? When can I leave my house? And this is really dependent on what the local public health team tells you. And so we would rather that you not make these decisions on your own. It's complicated and it's really dependent. Each individual case is different. And therefore we ask that you allow the local public health team to help you with your decision-making process. So this document can be found on the local, on the KMHC site under the reopening packages, the resources for reopening. We're going to put that link on the Facebook Live so that you can easily access it. And we hope that this will help you in your decision-making process. And again, if you have symptoms, we ask that you call and be tested. Our testing site is still open, will remain open, and we will continue to provide you with all the support you need in order to answer all your questions. So, thank you.
Yeah, well, Lisa, I'd just like to remind everyone that we currently have a contest going on where you have a chance to win a $50 Shop Kahnawake gift certificate. We're asking you to show us your washable mask. Send your picture and share it to Facebook. Also send it to us in a private message on the Kahnawake 911 Facebook page. The deadline is Thursday, July 24th, and we'll be selecting the winner on Friday. Up next, we have a video. It's the second in our New Normal series.
As businesses and public areas reopen, they will need to adjust their physical environment, workflow, service delivery, and culture as a preventative response to COVID-19. It is important to note that the level of risk also depends on each individual's decision and action. There's no such thing as reducing the risk to zero, but it is in our power to influence the outcome of COVID-19 with elements within our control. Try to wash your hands 5 to 10 times a day by rubbing them vigorously for at least 20 seconds each time. Create an environment where it's possible to wash your hands often, either with running water and soap or an alcohol-based hand sanitizer. You are not immune to any germs just by wearing gloves. Gloves spread microbes to everything you touch, your face, your cell phone, door handles. It is better to wash your hands with soap and water or hand sanitizer frequently and clean high-touch areas regularly. COVID-19, known as SARS-CoV-2, is surrounded by a lipid envelope that is destroyed by soap. The friction of washing your hands works to wash away the virus. It's known to be the most effective thing to do. If you're using hand sanitizer, make sure the product contains at least 60% alcohol for proper disinfection. Check the label to know the appropriate amount to apply onto the palm of your hands before rubbing your hands together. Avoid touching your face. If your hands are contaminated, touching your face will increase the risk of the virus entering your body through your mouth, nose, eyes, or ears. Infection prevention and infection control strategies will minimize the virus spread and keep our community safe. Behavior modification generates a wave of change. Each individual has the responsibility to implement these strategies in order to ensure a successful return to our new normal.
It wraps up our latest edition of the Daily Update. Our next episode will be on Thursday. We'll see you next time.